Hi, I'm John Weisman, Washington State Secretary of Health.
And hi, I'm Kathy Lofi. I'm the Health Officer at the Department of Health. And we're here today to celebrate World TB Day. Most people in the United States don't think about TB very often, but it's actually a very common infection around the world. About a third of the world's population is infected with the tuberculosis bacteria, which means that the bacteria is in their body. Of these people, about 10 million people will get sick from the infection, and almost 2 million people will die from the infection every year. Given that this disease is common around the world, it will always pose a threat to the health of people here in Washington. But fortunately, we have a public health system that can protect communities from tuberculosis. When a person here in Washington is diagnosed with tuberculosis, public health officials will immediately isolate that individual so that they're not able to spread the infection to other people in the community. Public health will also identify people who may have come in contact with that individual, test them for tuberculosis infection, and then make sure they get treated if they are infected.
As Dr. Lofi said, when TB is a great example for when public health is well funded, we protect the community. But you know, we also protect state and county budgets as well. That's because treating a case of latent TB, that is when they first become infected and before they're infectious, only costs about $500 a person. But if we wait to treat them until they actually have symptoms and they are infectious to others, that cost can range from $17,000 for a simple case to a drug-resistant case costing over $150,000 per person. So you can see public health is essential. It's essential to protecting the health of our community, and it's essential to protecting the health of our budgets in this state.
So in honor of World TB Day, I want to give a big shout out to all of the public health officials, laboratorians, healthcare providers, and other individuals who help protect our communities from tuberculosis every day.
Thank you.
Keep up the great work.